All right, let's go over pancreatitis. Pancreatitis is inflammation of the pancreas, usually caused by things like alcoholism, gallstones, immune disease, hyperlipidemia, to name a few. If it is not completely obscured by gas and you're scanning a relatively thin patient where you can see it well, you can go on. So in acute pancreatitis, the pancreas may, in early cases, appear normal, even in the presence of advanced disease sometimes. In the early stages, the gland is enlarged and hypoechoic with duct dilatation. The gland can then become heterogeneous with areas of increased echogenicity and focal or diffuse enlargement. Pseudocysts often occur. So here we have a view of the pancreas with pancreatitis. You can see there's some peripancreatic fluid. This is the liver here on both sides, falciform ligament. Now the pancreatic head here is enlarged. A normal pancreatic head measures from 2.5 to 3.5 centimeters. Now there's no actual measurement here, but you can tell qualitatively that it's enlarged. And here you have the aorta and IVC. And here you have a piece of the portosplenic confluence. And sometimes you may see the dilated pancreatic duct. The normal pancreatic duct measures usually below 2 millimeters, usually about 1 to 1.3 millimeters. Here's another acute pancreatitis. Here you see the spleen. So this is the tail of the pancreas at the spleen with a piece of splenic vein and splenic artery. You can see the gland is rather large and there's some peripancreatic fluid there. Now these patients will typically have epigastric pain that radiates to the back, nausea, vomiting, and they'll have increased lipase and amylase levels in their blood work. Now, in chronic pancreatitis, you can develop, the gland can become atrophic. It can also appear normal in some cases. It can have areas of heterogeneity, or the entire gland can be heterogeneous. It can have calcifications. Also, pseudocysts develop in 50% of cases of pancreatitis. And you can also see a dilated pancreatic duct. So here we have a fluid-filled stomach, piece of the liver, and a very heterogeneous pancreas. And here's a chronic pancreatitis with a considerable amount of calcifications. And here's a chronic pancreatitis with the development of pseudocyst. All right, I hope you found this interesting. Thank you. Bye.